All right, welcome to week 2, social welfare policy. I hope that you guys are okay. I know I've gotten some emails about the ebook not being accessible, so please email me if you're continuing to have issues with that. We're working on it on our end, just so that you guys are aware. I do not intend upon creating a Cengage course, therefore I do not have a course key code to email to you guys that you can access the ebook via the course key code. But I have posted an announcement on Canvas, and some students have been able to access the ebook without that code. So go in and look at the responses and give it a shot, see what these other students have done, and see if it works for you. But if you continue to have issues, please email me directly and we will work through it together. So I've read through all of you guys' discussion posts this week. I'm really excited to get to know all of you, and I love that I've had the opportunity to read kind of where you guys are coming from, what has propelled you into this career choice, and I think that a lot of you have a ton of insight and knowledge, and that I'm going to learn from each of you this semester in one way or another. It's kind of why I love being an adjunct professor, is that while I'm teaching this course, I'm really learning a ton from you guys and your experiences. So this week I kind of wanted to, and like I said in the last PowerPoint, I'm not here to teach you the book. I want you guys to read the book. I want you to understand the history of policy. I want you to read it, but I want to come at you guys with my personal, professional experiences and what I have found to be useful in creating change or being a changing agent in the field. So this week I kind of wanted to touch on that a little bit, kind of an introduction to creating change. So obviously you first off have to understand the problem. So being in the field of social work, you will come into contact with lots of people who have similar issues, right? So you will meet with people, for instance, where I'm at in addiction medicine right now, is I meet with people who have dental concerns, regularly talking with me about their inability to obtain dentures, okay? Not something I ever thought would be a concern when you think about substance use and recovery, but it's a real issue. And so the more and the more I meet with people, I start to realize there is a pattern here. There is a problem that a lot of people are having collectively, and there is not a solution. And so you have to understand the problem first. This problem being inability to obtain dentures. Lots of people. And that's kind of at the micro level. You're figuring that out through your direct practice with your clients or your patients. And what it turns into is more macro practice. You start reaching out to people, you start researching, you start trying to obtain contacts and understanding what's even out there, what can I access, what can I recommend to people. And if there is nothing there, you start to consider being then the changing agent, whether that be at a procedural level with your agency or at a level of policy change. It's something that you have to consider. So when you're working with your clients, be thinking about these things. Be thinking in terms of, wow, I've had 8, 9, however many people reach out to me this week with a similar need. And I'm doing all the research I can, and I'm not finding a solution to this need. and then you move on. You move up to the next step of how do I ensure that such resources are available. And that's when you start to think about connecting with other people and creating change, okay? So you, once you figure out that there's an issue, you got to understand the community in which you reside in. You got to do some research. Who's who? You got to connect with people. During my internship for my master's program, I spent a lot of time developing distribution lists so that I knew who I could, so that I knew who I could contact. And this right here is my file of distribution lists that I keep and I maintain and I update. And even, understanding who the superintendents are within the community, the fire chiefs, city government, faith initiative distribution lists, the Cabinet for Health and Family Services, just having the coalitions. I mean, you want to, start to develop these relationships with people, getting to know who is who in the community, so that then you have the ability to, when you have an issue, such as, for instance, going back to the dental concerns that I'm currently dealing with patients, is I can reach out to, for instance, the director of the Office of Drug Control Policy and say, hey, this is an issue. It's an issue for a lot of people. And how do we fix this issue? And do you know anyone? And do you have any leads? And are you writing any grants anytime soon? And do you want to entertain the idea of having some kind of denture assistance written within the grants that you're writing? These are the kinds of things that I'm doing to hopefully influence policy change, to hopefully then create less recidivism for clients, and hopefully then create more opportunity for our clients. So, start researching your community. I live in Northern Kentucky, so most of my research has revolved around Northern Kentucky. Okay? Again, understanding your community. It's always also good to understand the political affiliation in which your community, understanding how your community affiliates politically, okay? So there are lots of ways in doing this. I'll provide this PowerPoint so you guys can click through these links. But understanding political maps, like voter registration monitoring, understanding, for instance, if you go here, click on this, you'll see kind of an outline of the area in which, okay, so for instance, we're up here, right? Boone, Kenton, Campbell. Well, I am. I'm not sure. Some of you may live in Ohio. Or in other parts of the county. I know some of you said that you live in other parts of the state, or you grew up in other parts of the state. But this is really interesting because you can kind of see what you're working with here. So what I consider when I look at this is I reside, for instance, in Kenton County. And if I want to influence change in the county in which I reside, I have to consider that, and I'm kind of self-disclosing right now, but I'm a registered Democrat, okay? And as you can see, I'm outnumbered by registered Republicans, okay? And so when I go out and I try to influence change, I always consider and I think about ways to relate to the people I'm talking to. So for instance, I've attended events which were completely, like for instance, I attended a Republican slate event back before the last election. And I went because I wanted to talk to the people who are change influencers. And understanding that I live in a mostly Republican area, if I want to influence change, I am going to have to talk to Republicans, right? And I'm going to have to be able to connect with them in some kind of way. So, my advice in those scenarios is always to ask more questions, let them be the experts. Let them know what you think the problem is. And for me, when I approached people at these events, my focus was substance use recovery. And that is not a Republican or Democratic, necessarily a Republican-Democratic divide there. It's there still is some stigma that, is it really a medical condition? People, are they really making choice? Like, are they just making a choice to use, for instance? But most of the time, and in my experiences and talking with people at these events, people care about people. And if you can meet them at a place of that, they'll listen. And if you ask questions and let them be experts, they'll listen, and you'll connect with them, and then you'll maintain them as contacts as you move forward in within your career. So I kind of want to encourage you guys to think about those things before reaching out and talking to people. And then understanding legislation. You guys are going to have a paper coming up. And, well, I'm not sure what's happening there. Let's try again. There we go. Maybe. Understanding who your legislators are, and you guys are going to have a paper where you got to figure out some information about your legislators, where they stand, what their platforms are. There's just a lot of research. I guess what I'm trying to reiterate with you guys today is that there's a lot of research that goes into promoting change. And it's not as simple as sending an email, or you really got to sit back. You got to understand who your audience is. You got to understand how to approach the people that you're talking to. And what I've found to be impactful and effective is taking a more gentle approach. Not showing up with guns a-blazing, like, here's what I think, here's what needs to happen. I'm gonna, and peaceful protesting is great, but it's not always the most impactful way of promoting change in my experiences. And what I'm trying to tell you guys is, if you want to promote change, then you got to be a little bit reserved in some ways. And I'm telling you from my experiences, that it has been beneficial for me to take that approach. Okay, so that's kind of all I wanted to really talk with you guys about tonight. You guys have your discussion 2 posts, and like I said, if you guys are still having issues with your ebooks, let me know, and give me some feedback on this too. If you watch this and it makes you feel some kind of way, reach out to me if you have questions, or you want to further inquire about why I'm coming from where I'm coming from with this. Please reach out. Like I said, I can learn as much from you as you can learn from me. So I hope you guys are enjoying yourselves these last few weeks of summer, and I will see you guys soon.